I hope I am audible to all of you. So I welcome you all back to the session of Sparks, and today's session will be about PSM rapid revision and chanting, as all of you are quite aware of. So those who are new to the session, I am Dr. Omkar Sangita Dilipra Sonone, and today I'll be discussing about PSM part 3 because we have already had 2 sessions earlier of PSM. Today's session will also be a shorter one because I know all of you are exhausted, mainly the Fmge students. So taking that into consideration, I'll not stretch the class. So yeah. So along with the images, we'll also discuss other important points too in today's session, not only the things related to images, but also some important theoretical part from PSM will be discussed in today's session. And please be interactive in today's session also. Please answer all the questions because that makes the session more interesting and fruitful for you as well, right? So let's begin the session. Lend me a minute for this and we'll start. Yeah. So I hope it is pretty visible to all of you. And on this note, let me begin the session. So last time we completed all the health programs of India, all the important health related agencies of India. So today we'll be discussing about other important aspects of PSM, right? In the last class we discussed some important points about the epidemiology. So today we'll again start with some important other aspects of epidemio, and those are the most important points of epidemiology, that are your studies. Okay, so as we all are quite aware that there are various types of studies, right? So as we are quite aware that there are various types of studies, those are important from PSM's point of view. So mainly the studies that are there, let's see first of all what are these studies and then begin our session. Okay, so yeah, so first of all, these epidemiological studies, all of them are divided mainly into 2 groups. Okay, so please remember these epidemiological studies are mainly divided into 2 groups. First being the observational studies and second are your experimental studies. So observational studies are further of 2 types. First are your descriptive studies and second is your analytical studies. Okay, so please remember in descriptive studies usually a hypothesis is formulated. A hypothesis would be formulated. In analytical study the hypothesis would be tested. Okay, and in experimental studies usually the hypothesis would come into existence. Okay, so experimental studies are also known as interventional studies. Please remember this. So these are different types of studies. And the analytical group of studies have further 4 types of important studies that we need to discuss today. Okay, those are your cohort study, case control study, cross-sectional study and ecological study. So all these 4 studies, they come under which group? They come under analytical studies. Okay, they all come under analytical studies. Okay, so now I'll keep on switching on in between, so that would be better. Okay, just a minute. Yeah, so let's discuss about the different types of studies. So जो first image दिख रही है, so please remember guys, that is your prospective cohort study. The first image that you can see over here, it is your prospective cohort study. So what do we mean by prospective? Prospective means forward looking study. What do we mean by prospective? That means a forward looking study when we go from risk factors towards the disease. So please remember, whenever we go from risk factor towards a disease, that is known as a prospective or a forward looking study. Okay, so please remember prospective cohort में क्या होता है? We go from risk factors to a disease or from exposure to an outcome or from cause to an effect. Okay, so that usually comes under the prospective cohort study. Please remember this. Okay, so for example, we have 100 smokers in our population, that would come under these exposed group, and we have 100 non-smokers in our study groups. Okay, so please remember, usually 2 study groups are taken into consideration. Minimum 2 study groups should be there. Okay, so please remember, one is the exposed group and second is the non-exposed group. Please remember this. Okay, so if we have 100 smokers, out of them, for example, 80 develop lung cancer. Okay, out of them 80 develop lung cancer, and out of the 100 non-smokers that we have, only 10 develop lung cancer. Okay, so this is how a prospective cohort study is actually undertaken. Please remember this. Okay, so now can anybody tell me what is used for measuring the strength of association in a cohort study? Can anybody tell me this? Please answer. What is used to measure the strength of association in a prospective cohort or a retrospective cohort study for that matter? Anybody? Which is the strength of association? So we need to look for strength of association. Strength of association tells us that whether the risk factor is strongly associated with the outcome or not. Okay, that is told by the strength of association. So can anybody tell me? Yes, very good, Komal. Yes, important one, it is relative risk. So please remember, relative risk actually is used for measuring the strength of association in cases of cohort study. Okay, and what is the formula for relative risk? So please remember, the formula for relative risk would be incidence in exposed upon incidence in non-exposed. Incidence in exposed upon incidence in non-exposed into 100. Okay, so please remember this. Okay, and what do we mean by incidence? So incidence is only the new number of cases. Incidence is the new number of cases, whereas prevalence is, on the other hand, it is the new as well as old number of cases. Okay, the total number of case would be prevalence, whereas only the new number of case every year would be your incidence. Please remember, relative risk का formula क्या है? Incidence in exposed upon incidence in non-exposed. Okay, next one is your retrospective cohort study. In retrospective cohort study, so what happens over here? So please remember guys, actually the study begins from the outcome itself. Okay, so you will say that from the outcome usually a case control study begins. So what is the difference between a case control study and a retrospective cohort study? So please remember guys, usually in case control study the risk factor is unknown. You are trying to find a risk factor for the disease. But in cases of retrospective cohort study, you actually know a risk factor. For example, lung cancer is the outcome, and you are trying to find that how many smokers actually develop lung cancer. Okay, so you know a risk factor that you are trying to assess the strength of association for. Okay, so yaad rakhna, in retrospective cohort you go backwards, but at that time you are looking for a particular risk factor, whereas in cases of case control, though you go backward like retrospective cohort, but you do not know the risk factor. You are trying to look for some risk factor. Okay, so please remember, this is the basic difference. Okay, now next analytical study, the third one in this is your case control study. Okay, the next one in line is your case control study. Usually again we'll have 2 groups. One is your exposed group and second is your non-exposed group. Okay, and you're trying to compare them, both of them. So you're going backward, that is from the disease towards the risk factor, or from outcome towards the exposure. Okay, or from effect towards the cause. So that is your case control study, which is a backward looking study. Okay, please remember, that is your case control or a backward looking study. Can anybody tell me what is the strength of association? Like what is the parameter which is used to measure the strength of association in cases of case control study? This is a backward looking study. So in this cases, you are actually trying to take the history from your patient or take the history from a diagnosed case, and now you are looking for some risk factor which will be associated with this disease. Yes, very good. It is your odds ratio. So please remember, it is your odds ratio, also known as your cross product ratio. Also known as your cross product ratio. Okay, that is AD upon BC. Okay, please remember, it is AD upon BC. So this is your cross product ratio, also known as your odds ratio. Now just remember guys, we need to look for important differences between the cohort study and the case control study. On what are these important differences? Please remember, cohort study actually is a very time consuming study, because we need to wait till the patient develops a disease. like it will take mostly 10 years, 20 years for the patient to develop a disease. So cohort is a time consuming study. On the other hand, case control is a quicker study. And as cohort is a time consuming study, it is also expensive, whereas case control is a cheaper study, right? Important one. Whereas the third difference is very much important. The strength of association in case of cohort is calculated by the relative risk, whereas the strength of association in case control study is calculated by this odds ratio or the cross product ratio. Important one, right? Now can anybody tell me, we have two important biases, okay? One is the Hawthorne bias and second is the recall bias. So can anybody tell me which type of bias is seen usually in cases of cohort study? Which bias is seen in cases of cohort study? Which bias is seen in cases of cohort study? Is it the Hawthorne bias or the recall bias? Be interactive, guys, please, so that will be better for you as well. So whether it is the Hawthorne bias or the recall bias seen in cases of cohort study. So yaad rakhna, guys, please remember, in cases of, yes, very good Komal, it is your Hawthorne bias. Okay, so what do we mean by Hawthorne bias? For example, you are taking 100 people who are smokers, okay, for your study, but out of them, like 10 people fall out, okay, 10 people, they quit smoking in the course of the study, okay. So, and without informing you, without any prior notice, these 10 people, they just fall out of the study, okay, or they quit the behavior, and this is known as your Hawthorne bias, which is usually seen in cases of cohort study, whereas recall bias would be seen in cases of case control study. Because what happens in case control study, we are trying to take the history and the patient could not recall properly, and therefore if the patient doesn't give history properly, this is known as your recall bias. So please remember, recall bias in case control study, whereas Hawthorne bias in cohort study. Very much important, okay. Which is the study which is usually used for rare diseases? Yes, very good Komal. Attrition bias is also seen in cases of cohort study. Yaad rakhna, attrition bias is also seen in cases of cohort study. Attrition is the same, that is, for example, there is a loss to follow up, okay, because in case control, in cohort study usually you have a longer follow up to take. So if for example, if the investigator fails to take the follow up, if there is any loss of follow up, this is known as the attrition bias, which is also seen in cases of cohort study. Can anybody tell me which is the study out of these two which is used for rare diseases? The important study which is used for rare diseases, whether it is cohort study or it is case control study, which is the important study which is used for assessing the rare diseases? Important question which have been asked earlier in the examinations. So please remember, guys, in cases of rare diseases, usually you prefer case control study. In cases of rare diseases, you usually prefer case control. No, Komal, please remember, cohort study में you cannot actually तुम अपने patient को खाई में नहीं धकेल सकते, right? So you cannot ask your patient to risk his life in cases of rare diseases for which you do not even know the treatment for, right? So for those cases, you actually take the history from the diagnosed ones, okay? So you only take the history from the diagnosed ones. Therefore, for safety measures for rare diseases, case control study is the best study which is used for assessment, okay? Please remember this. Whereas in case control study, we can study multiple risk factors together, but in cohort study, we will actually focus on one single risk factor, right? Important one. Moving further, next one is your cross-sectional study. Next one is your cross-sectional study. What do we mean by cross-section? Cross-section means at a particular point of time. So cross-sectional study is also known as a snapshot study. Cross-sectional study is also known as a snapshot study, in which we actually take the number of the cases, okay. So for example, we take the number of smokers, that is 26% of the total population are smokers, and 10% of the total population have developed lung cancer. So this we are actually taking at a particular point of time, right? This study do not have a direction, neither backward nor forward, okay. So this study, cross-sectional or snapshot study, does not have a direction, okay. Please remember this. So it is a snapshot or a cross-sectional study which is actually used for assessing at a particular point of time. Important one. Okay, so here you cannot see any arrows. That means this is a cross-sectional study design. If you cannot see any arrows, then it is suggestive of a cross-sectional study design. Important one. Okay, so now just talking about the unit of study. Can anybody tell me what is the unit of study for your cohort study design? What is the unit of study for your cohort study design? Whether it is an individual or a population or community, family or a group. Can anybody tell me what is the unit of study for cohort study? Unit of study is what in cases of cohort study? This is an important question which have been asked. So please remember, the unit of study questions have been asked for unit of study. Can anybody tell me unit of study in cases of cohort is? Yes, please remember, it is an no. Not population. Please remember, in cases of cohort study, not population. Please remember, guys, in cases of cohort, case control or cross-sectional study design, individual is the unit of study. Okay, we actually take an individual into consideration. So please remember, it is an individual who is taken into consideration in cases of cohort, cross-sectional as well as case control study design. Only in cases of ecological study, population is the unit of study. Only in cases of ecological study, population would be the unit of study. Please remember. And ecological study is used for what? Ecological study would be used for nutritional surveys, right? So ecological study is usually used for assessing nutritional surveys, and the unit of study in ecological is population, whereas in all the rest three, that is cohort, case control and cross-sectional, it is the individual who is the unit of study. Important one, yaad rakhna. Okay, on these questions have been asked. Okay, now moving further, guys, to our next one, and that is about your population distribution. Okay, so this is your population distribution graph which can be seen. Okay, in cases of developed countries, the population graph would be somewhat of spindle shaped. Okay, please remember, the population graph would be of spindle shape in cases of developed countries like the USA or UK. Okay, so this is a graph for United States of America which is spindle shaped. So it is spindle shaped because what? So please remember, this is spindle shaped because the number of males and females is more or less the equal. Okay, so the sex ratio is more or less the equal. Important one. Second, they have more number of working population. Please remember, these developed countries usually have more number of working population. So these are the two important things due to which the developed countries have a spindle shaped graph. The developed countries have a spindle shaped population distribution graph. Whereas in cases of developing countries like India, we usually have a pyramidal shaped graph. कैसा graph होता है? Pyramidal shaped graph is seen usually in cases of developing countries. Okay, so what that suggests? So please remember, it is an unequal graph. This is an unequal graph. Okay, so please remember, usually the male ratio would be more as compared to the females. Okay, so the sex ratio is more inclined towards the male side due to female feticides or infanticides. First thing. And the second thing, important one, these people usually have majority of the younger population, majority of kids. Okay, so please remember, due to excessive population, these usually have, the developing countries usually have more number of younger population. Okay, important, true things to be remembered. Developing countries have a pyramidal shaped population distribution graph, whereas developed countries have a spindle shaped population distribution graph. I hope this is clear to you. Okay, so agar image aati hai, if graphs come, if it is spindle shaped, it can be a developed country, and if it is pyramidal shaped, it would be a developing country. Okay, please remember this, important one. Moving further. Okay, just before moving further, guys, I want to discuss some important points. Okay, so those are really important from epidemiology point of view. So let's go to them first and then come back to our image session. Right, so over here I wish to discuss important points about confounding. So please remember, guys, what do we mean by confounding? So please remember, confounding means a known error. Okay, so it is a factor which is related both to the exposure and outcome. Please remember, confounding is a factor which is related both to the exposure as well as outcome, and therefore this factor would lead to a defective outcome. This factor would lead to a defective outcome. This is known as a confounding factor. Okay, so for example, males, okay, or adult males, both of these factors are related to smoking as well as lung cancer both, right? So adult males, उनमें smoking ज़्यादा होती है, and both of them they develop more commonly lung cancer. So if this factor is only taken into consideration, that can lead to errors while the final calculation. So please remember, this is known as a confounding factor. So confounding factor is a factor which is related both to the exposure as well as the outcome. Important. And what do we do for overcoming this confounding factor? So please remember, the technique which is used to overcome this confounding factor is known as matching. So please remember, what do? We do matching. So matching से क्या होता है? In matching, usually there is equal distribution of that common factor in both the groups. For example, we had two groups, A group and B group. First, we had confounding in our study. That means in A group, we had 80% of adult males, and therefore almost 60% of them developed lung cancer. And we came to a conclusion that A group was more susceptible to develop lung cancer, whereas we did not take this into consideration that the B group had only 20% of males, therefore only 10% of population in this group actually developed lung cancer. ठीक है? So this was the confounding factor which had an effect on the outcome. Okay, so this was your confounding factor. So now what do we do in matching? Usually if there were 80% population in this A group of males, then we try to distribute it equally. Okay, we try to distribute it equally, that is 50% in A group and 50% in B group. This is what we do in matching, that is equal distribution of the common factor in both the groups is done, and it is used to remove confounding. Important. Next one is your bias. Okay, important. Next one is your bias, and bias is of three types. First is the subject bias, second is the investigator bias, and third is the analyzer bias. So subject bias, as we have already studied in cohort and cross case control, those were your Hawthorne bias and the recall bias, which were related to your study subject or to your patient. Important. Second is your investigator bias. That can be interviewer bias. For example, the interviewer may give more time to the cases as compared to the controls, right? So that can be seen in interviewer bias. And second is your selection bias, the same one. Okay. In selection bias, maybe only males are selected in A group and females are selected in B group. So that can lead to definitely a defective outcome. So please remember, both of these, interviewer and selection bias, are a type of investigator bias, whereas calculation errors, they come under analyzer bias. Okay, and again one more important bias that you need to remember, and that is your Burkisonian bias. कौन सा bias? Burkisonian bias. Question have come on Burkisonian bias. What do we mean by Burkisonian bias? It is different hospital admission rates. Okay, so Burkisonian bias is due to different hospital admission rates. For example, I'll try to explain you. In 2020, a medical college did not have pulmonary medicine department, and therefore only 10 cases were actually diagnosed of pulmonary medicine that year in that particular medical college. But in 2021 now, they have a special department of pulmonary medicine in their college, and therefore now they have 50 diagnosed cases of pulmonary medicine. Okay, so please remember, from this we could not come to a conclusion that incidence of pulmonary medicine cases have increased in 2021. Okay, so that can be an error, or that can be a bias. So please remember, this is known as your Burkisonian bias, which is due to different hospital admission rates. Okay, this is known as your Burkisonian bias. Next one is your blinding. So blinding matlab kya? The subject or the interviewer, or finally the analyzer, all of them are unaware of the intervention which is performed. Okay, so single blinding में क्या होता है? The subject is unaware of the intervention. Only the subject is unaware of the intervention. That is known as your single blinding. Double blinding में the subject as well as the investigator, both of them are unaware of the intervention. Double blinding में subject as well as the investigator are unaware. Triple blinding में subject, investigator as well as the analyzer are unaware of the intervention which is performed. The most common type of blinding used is, so please remember, the most common type of blinding used is double blinding. Most common type of blinding used is double blinding. But the best type of blinding is triple blinding. याद रखना, इस पे क्वेश्चन था blinding पे. Most common type of blinding used is double blinding, whereas the best type of blinding used is triple blinding. Okay, important ones. Next is your experimental studies. Okay, we have studied about the analytical studies. There were 4 types: cohort, case control, cross-sectional and ecological. Now coming to the experimental or the interventional studies, and the best study out of them is your RCT. Okay, RCT, that is your randomized control trial. Okay, important one. In this there are 2 groups. Okay, there are 2 groups. One is the experimental group on which the experiment would be performed, and second is your reference group. Both of these groups have patients or diagnosed cases in them. So the unit of study in RCT would be patients. Yaad rakhna, the unit of study in randomized control trial would be patients. Unit of study in RCT would be patients. Very important guys, this is different. Okay, randomization means what? इसके ऊपर भी नीट पीजी में एक बारी क्वेश्चन था. What do we mean by randomization? Randomization means equal and known chance. Okay, so please remember, equal and known chance to be selected in a study group. This process is known as randomization. This is known as your randomization. Okay, and randomization is the best technique to remove any confounding or bias. Okay, to remove confounding or bias, the best method is your randomization. Okay, yaad rakhna. Now a question can come, which is the best study design out of all? Which is the best study design out of all? So please remember, the best study design out of all, it is your meta-analysis. Best study design out of all is your meta-analysis, followed by randomized control trial or RCT, followed by prospective cohort, followed by retrospective cohort, followed by case control, followed by cross-sectional, and lastly is your ecological study. So the best study design would be meta-analysis, and second best would be RCT or randomized control trial. Okay, let's discuss one more important phenomena of clinical trials. Okay, one more important phenomena of clinical trials. This we have already discussed in pharma, but just revising it once again. Clinical trials are actually used for launching a new drug. Yeah. I hope now it is fine. Yeah. So please remember guys, in phase 0 the unit of study would be healthy human volunteers, and it is your microdosing phase. In this only 1/10 of the actual dose is given to the population, all the volunteers. Only 1/10 of the actual dose is given. Next is your phase 1. In this also the unit is healthy human volunteers. Okay, and phase 1 is usually used for assessment of the safety or toxicity profile. So please remember, it is used for assessing the safety or toxicity profile of a drug. Along with that, it is also used to assess the maximum tolerable dose. Okay, so please remember, maximum tolerable dose is actually assessed in phase 1. Maximum tolerable dose is usually assessed in phase 1. Safety and toxicity profile of a drug is assessed in phase 1. Yaad rakhna. Next one is your phase 2. And phase 2 is the first phase where are patients taken into the study. So patients सबसे पहले कहाँ लिए जाते हैं? This is a question which has been asked. So patients are first taken into the clinical trials in phase 2. Patients are first taken into the clinical trials in phase 2. And phase 2 is used actually for efficacy determination. Phase 2 is usually used for efficacy determination. याद रखना. Next is your phase 3. Phase 3 में also the unit of study would be patients. So phase 2 onwards the unit of study are your patients. So phase 3 में the unit of study are patients, and this phase 3 is used for efficacy confirmation. The efficacy was determined in phase 2, but it is confirmed in phase 3. Okay, and in phase 3 also we compare the new drug with an existing drug. We compare the newer drug with an existing drug. And last is your phase 4. Phase 4 maybe patients are taken into consideration, and this is used for long-term side effects. To assess the long-term side effects, which is the phase of clinical trials used, it is your phase 4. Okay, so this phase is also known as your post-marketing surveillance, because after phase 3 marketing of a drug can be done. After phase 3 the drug comes into the market, therefore phase 4 is known as a post-marketing surveillance. Okay, and what is the time period for phase 4? So please remember, the time period for phase 4 would be lifelong. Minimum it would be 10 to 25 years, but the best answer would be lifelong. So the phase 4 of clinical trial would last lifelong. Yaad rakhna, important. Can anybody tell me maximum failure chances are seen in which phase of the clinical trials? Maximum failure chances are seen in which phase of the clinical trials? As we all know, preclinical trials are used. Preclinical trials are done on animals. याद रख लेना, the unit of study in preclinical trials are your animals. Can anybody tell me, clinical trials से question पूछा है मैंने, maximum failure chances, no, not phase 3, right? Please remember, it is a phase 2. याद रखना, it is a phase 2 in which maximum failure chances are seen. So please remember, maximum failure chances are seen in phase 2. Okay, when the drug doesn't work even. Okay, when, for example, you are bringing an antipyretic drug in the market, but the drug is not able to work on fever. So maximum failure chances are actually seen in phase 2. Important. याद रख लेना. Please remember this. We have already seen these different types of theories of disease causation. Spontaneous generation theory was given by Aristotle. Germ theory of disease was given by Sir Louis Pasteur. Multifactorial generation theory was given by Patent-Coffer, and web of causation theory was given by McMahon and Pugh. We have already seen this. Next, father of epidemiology and modern epidemiology, it is John Snow. Father of public health is cholera, the disease on which John Snow studied. Father of medicine is your Hippocrates, and National Institute of Epidemiology is located in the city of Chennai. Right, important one. This we have also discussed, epidemiological triad, triangle, and advanced epidemiological triangle. Okay, all of these we have discussed in the images part itself. Now we'll talk about some important tools. Okay, ये याद रखना important because at times calculations can come. So at least you need to know these 3 important tools. Okay, that is your rate, ratio, and proportion. Okay, so please remember, rate का formula क्या होता है? It is A upon B into 1000. A upon B into 1000. So what is important over here? The multiplier is important over here. Okay, multiplier is important. याद रखना, the multiplier in cases of rate is always 1000. The multiplier in cases of rate is always 1000. Then the second important thing, that A is part of B. That is, the numerator is part of the denominator. For example, if I talk about the infant mortality rate, so I'll say that the number of infant deaths upon the total number of live births into 1000. So this is the formula for your infant mortality rate or IMR. So here A is part of B, right? The numerator is part of the denominator. So please remember, in rate, A is part of the B into 1000, which is the multiplier. Okay, and the examples of rate would be incidence is an rate, and infant mortality rate is also rate. याद रखना. Next is your ratio. Ratio में the multiplier can differ. It can be 100, it can be 1000, it can be 1 lakh. Okay, so it can be in multiples of 10. याद रख लेना. So in ratio the multiplier is different. Okay, and the second important thing, that A is not the part of B. Okay, for example, talking about the sex ratio, that is number of females per 1000 males. Here A is not part of B. So please remember, the numerator is not the part of denominator in cases of ratio. I hope now it is fine. Sorry for the constant interruption, guys. Can anybody tell me what is the current MMR and current IMR of India? Current MMR and current IMR of India, can anybody tell me the values according to the recent sample registration survey of May 2020? In the meanwhile, I'll explain you proportion. So proportion क्या होता है? A upon B into 100. Again here A is part of B, that is the numerator is part of the denominator. Okay, and the multiplier is always 100. In cases of proportion, the multiplier is always 100. Okay, and proportion is expressed as percentage. P for proportion, P for percentage, ऐसे याद रख लो. So proportion is expressed as percentage, and the examples of proportion would be prevalence or secondary attack rate. Both of these are examples of proportion which are expressed in percentage. Yes, very good, Bright. 113, very good, Komal. 113 is the current MMR or maternal mortality ratio of India, 113. Whereas the current IMR is, so please remember, the current IMR of India is 32. Okay, the current IMR of India is 32. याद रखिएगा. Current IMR of India is 32 per 1000 live births, whereas current MMR of India would be 113 per 1 lakh live births. Okay, याद रखिएगा. Next is your incidence. So incidence is what? Incidence is the new cases upon the susceptible population into 1000, and as 1000 is the multiplier and A is part of B, therefore incidence is a rate. Okay, therefore incidence is an rate. Next is your prevalence. Prevalence का formula क्या है? that is new as well as the old cases upon the total population into 100. As 100 is a multiplier and A is a part of the B, therefore prevalence is an example of proportion. Prevalence is an example of proportion. So P for prevalence, P for percentage, P for proportion. ऐसे याद रख लो सब. Then sex ratio, it is number of females per 1000 males. Can anybody tell me, according to the census of 2011, what is the sex ratio of India? What is the sex ratio of India according to the census 2011? The census of India 2011 tells us what is the sex ratio. The connection would be fine. Is it fine now? Just let me know. Is it fine now? So guys, a good news for those who are in Gautam Nagar already. So from tomorrow onwards, Fmge will be starting offline chanting sessions also. So all these issues would be resolved. Along with that, we will also go live from the classes itself. But yeah, there's a good news that we will be starting offline chanting sessions, which will be helpful for all of you, and we can avoid any kind of disturbance. So now you need to remember these most important images, guys. First one that you can see over here is your male condom. Okay, first one that can be seen in the picture is your male condoms. Okay, and what is the Pearl index for male condoms? It is 2 to 14 per 100 women. Those who want to join can come into the classroom. So please remember, Pearl index what? Pearl index is an indicator of contraceptive efficacy, or it is an index to measure contraceptive failure. Yaad rakhna. It can be defined as an indicator for contraceptive efficacy, or it is an indicator for contraceptive failure. Yes, sure, we'll continue online also. I'll be going online live from the class itself. Okay, don't worry about that. So what is the Pearl index for male condoms? The Pearl index can be asked, guys. Please remember, the Pearl index for male condoms would be 2 to 14 per 100 women years. The Pearl index for male condoms would be 2 to 14 per 100 women years. Okay. Next one that you can see in the image beneath it, that is your female condom. So please remember, it is a longer one. Okay, that the female condom, and there are 2 rings to it. So this is a female condom, and the Pearl index for female condom is 5 to 21 per 100 women years. The Pearl index for female condom is 5 to 21 per 100 women years. Okay. The next one that you can see over here, this image shows you a contraceptive that is known as a vaginal sponge. So please remember, this contraceptive is known as a vaginal sponge, which is actually famous by the brand name Today. So please remember, this is a vaginal sponge or Today. So the Pearl index for this vaginal sponge is 9 to 20 per 100 women years. The Pearl index for this vaginal sponge is 9 to 20 per 100 women years. Important, yaad rakhna. And the next one, the last one that you can see in this pink box, I'm just not sure why it is stuck again and again. I'll try to so I hope this is fine. I want to ask you guys, shall I continue today itself because there is a lot of internet interruption, or shall we continue tomorrow itself in the offline class? So it would be better. I can deliver much better over there, and the internet connection would also be better over there. So what's your thought? Just let me know in the chat box so I can continue, because contraceptive is a very important topic. You need to understand it thoroughly. So if you are having any interruptions in between and the topic is not understood properly, there is no use of it. So if you are fine with it, I'll continue tomorrow itself because of these internet connectivity issues. Sorry for the interruption again and again, but just let me know. So it would be better. So I hope I'll see most of you in tomorrow's session. That would be our first live interactive session offline. Yeah, first live interactive session offline. I'm glad that I'll see most of you over there. Please inform your friends also. Yes, for all non-Fmge students also, offline chanting will be available. Okay, So you are wholeheartedly welcome in the classroom. All of you might be aware, in near Green Park Metro, you can find Fmge's class. Okay. If you're not aware, please just check on Google also. It will show you the exact address. So I'll be informing you the time soon, because I also need to consider the regular batch students of Fmge. So accordingly, I'll be informing you the time. Okay. So it would be like in the night itself. So let's see you tomorrow.